Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts. And I'm excited to kick off Season 2 of our podcast series in partnership with Rappahannock Electric Cooperative. It's called We Are REC. Every week we'll release a new episode talking to different people from REC about a host of different topics. We'll get tips for saving money on your electric bill. We'll talk about renewable energy and the impact it can have in our communities. We'll get some behind-the-scenes info about what happens when the power goes out in a storm. Don't miss out on information about community grants, scholarships, REC-hosted events, and more. Get every single episode on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcasts, Google Podcasts, or on Spotify. Just do a quick search for We Are REC. Hello and welcome to The Valley Today. I am your host, Janet Michael. Today's show is part of our community health series that we do every month in partnership with Valley Health. We have recorded today's show over Zoom on a Tuesday afternoon, and we have a repeat guest joining us on the screen today. Dr. Rocky Fowler is meeting me on Zoom. He is a family medicine practitioner located in the Valley Health Warren Memorial Hospital multi-specialty clinic on Commerce Avenue. Dr. Rocky, thank you for taking some time to meet with me today. It's good to see your face of sorts.
Hi, Janet. It's good to be back.
So I want to start with, before we set up to record today, I went back onto the station's website and pulled the last show when you and your brother Tolbert were on the show. That was March 19th. Now, it feels like it was 100.5 years ago.
Oh, does it ever?
Can you just stop for a second, even as a physician, and think about everything that has happened since you were on the show the last time in March that was only a few short months ago?
If you had asked me back then, did I see the face of medicine changing? I would say, no, not for a while. You know, of course it's ever changing, but not the way it has. Telehealth has been incorporated tremendously into medicine now. It's almost shifted overnight to where we're seeing patients remotely. And it's a benefit to a lot of people who didn't have access before. So especially the elderly people that can't get out of their homes and come to the clinics, you know, nursing home patients, same thing. So yeah, it's changed tremendously. I'm shocked.
Well, and we had conversations before we started doing the show that day about COVID-19. And then we were still in the very, very early stages. We didn't really know what was going on. We weren't even into a shutdown at that period. And you had some concerns because you understand how viruses work and what the potential could be. But man.
Virulent, progressive, all those words come to mind. And you're absolutely right. I never thought this would happen, and it literally changed everyday life the way we know it. And I think it will change it to where people will be more cautious in the future of getting anything, you know, infectious close to them. So absolutely. And yeah, we were still going about everyday life, seeing every patient in clinic, doing everything in clinic, not doing any telehealth. And then, you know, all of a sudden, massive shutdown, all elective procedures canceled. Most surgeries that didn't need to be done right then were canceled. It just turned the world upside down in medicine as we know it.
And I think there are some good things that have come out of it. You mentioned the telehealth. I mean, there are certain things that you probably and Valley Health System as a whole would have done eventually on a larger scale. This just kind of sped that process up some more. And now you're in it, and you'll probably continue doing telehealth forever until something better and bigger comes along.
The best thing to come out of it was people's patients or the public's apprehension of telehealth. They didn't know. They're very skeptical. Most people were, even my own family. And this has been a really good thing because it's actually kind of made people, instead of dipping their toes in the water, jump right in. And they did it really well, and they went along with it really well. Now, most people, you know, it's a mix, 50-50 of who like it and who don't. But it's served a good purpose, and it's really gotten the public used to telehealth visits, and they're here to stay.
Well, and it, like you said, it serves a purpose for certain things. But let me ask you, because you are in family medicine, what does somebody do now? I mean, we still don't know what's going on with the schools. They may or may not start. Kids may or may not go back to college. But let's say in a perfect world, some schools start somewhere and my kid needs to have a physical, for example. Are you open? Is your office open for those kinds of things? How is all of that working now?
Absolutely. We are open. Any new patient that doesn't have any symptoms of coronavirus or sort of have a fever, cough, or any troublesome symptoms, diarrhea, nausea, we are seeing those inpatient in the clinic. It's hard to do a physical remotely, so that's why we made an exception. But you can definitely come in, get a physical, especially sports physicals, because school may not be starting up yet, but sports sure are. They haven't waited. So there's different guidelines, of course, of the distancing and everything, but they're starting up. So the sports physicals are in full swing right now.
So do I make an appointment like I would for a normal? Obviously, I'm not going to just show up because nobody is allowed to just show up anywhere anymore, I think.
Yes, exactly. No, you just call the number and make an appointment, and we'll get you right in. We can usually fit you in within a day or two.
Are you doing the same types of protocols that my husband had an accident at work a couple of weeks ago, and we made an appointment at urgent care, and he had to check in ahead of time. He had to call when he was in the parking lot. There were all of these new procedures in place. Are you implementing those at your office as well?
Yes, ma'am. We're doing those. We've like I said, there's a questionnaire of certain list of questions, very brief, but down to the point. Do you have a fever, things of that nature? And, if you do, we have a special clinic. If you are symptomatic, you want to call your doctor right away, whether you're in the parking lot or not, and we can actually guide you to a special clinic where we see respiratory patients with any sort of COVID-like symptoms here in Front Royal. So they'll be set up. Everything is taken care of. All you have to do is call our clinic number, and even if they don't have a primary care doctor, they'll be taken care of.
And I think it's important to point out that respiratory care clinic, while it was set up mostly for treating or diagnosing COVID patients, there are a lot of respiratory illnesses out there. And if you have symptoms of something that isn't COVID related, it's still very safe to come to that clinic. You guys have everything kind of separated. You're taking all the precautions. Don't not go because you're afraid of getting it, for example.
We clean, sterilize everything. It's 40 minutes in between patients in a room, which is the standard requirement for sterilization. And yes, if you have COPD exacerbations, bronchitis, cough, any kind of complaints like that, you could be seen here. And it doesn't necessarily have to be COVID-like symptoms, no.
And I know that from having conversations with several of the other physicians throughout the Valley Health System, I can't remember which one said this, but one of them said to me that if you have never really had allergies before, don't assume that if you suddenly have a tickle in your throat or you're sneezing or you're coughing, that now suddenly you have allergies, and not quarantine yourself or get it checked out. Is that? Did I understand that correctly?
That's a very smart man, whoever you talk to.
I'll have to go back and look at my show notes.
He's very right, yes. But there's a lot of asymptomatic cases in our area and people who are never display any symptoms. So it's really hard to tell. This whole thing's been evolving ever since March. And it's tough to tell each week as we go, but we just kind of do the best we can and serve the public the best we can.
And we were talking earlier about telehealth. You could do a lot over a Zoom screen like this on somebody's phone, or if they're on their laptop or their iPad. There are a lot of things that you can diagnose and walk people through using telehealth.
In the comfort of their own home. I mean, it's a really good system. There were actual hospitals all over the country who were doing Zoom visits of the doctor just standing outside the door of the room that they were in the hospital of a critical care unit. So, and of course, if anything they feel they need to go in, they could go in and see and examine the patient. But we can do a lot of stuff with Zoom and telehealth visits as far as like diagnosing complaints. I'll tell you, like one of my old mentors told me in family medicine and residency, he said about 75% of what we diagnose someone is what they tell us. So that depends a lot. You can tell me on a computer screen the way anybody can tell me, or on the telephone. So it's been a real blessing for a lot of people in this time of need.
Well, and it probably really does come in handy too for things where people have some sort of an illness that they just need to have regular checkups. They just need to check in to make sure that everything is on track. You can still go get blood work and things like that done, but not have to come into the doctor's office to review those results anymore. You can do it over telehealth.
Absolutely. As long as you have any symptoms and you wear a mask, we're perfectly fine with it.
Well, let's take a break. I've got a spot on my arm that I think might be poison. I'm going to put up in front of the camera during the break so you can look at it.
You always hit me up for something every time we talk, Janet. I don't mind one bit, though.
This is what I love about this radio show is it gives me access to so many things.
I wish you could see me smiling under this mask right now.
We are going to take a quick break. When we come back, we are going to continue our conversation with Dr. Rocky Fowler. He is a family medicine practitioner at Valley Health Warren Memorial Hospital's multi-specialty clinic. They are located over on Commerce Avenue. This is part of our continuing community health series in partnership with Valley Health. I am Janet Michael. This is the Valley Today, and we'll be back in just a couple of minutes.
Do you know anyone who is struggling with financial hardships because of coronavirus? Our new webinar called Coping with the Money Crunch can help. We'll talk about immediate options to consider, revising or creating a spending plan, and lots of community resources. Then we'll cover how to narrow your priorities, contact creditors, and avoid scams and risky loans. The webinar is free, and you can either join by phone or through Zoom on a smartphone, tablet, or computer. You can find out more by visiting the Northern Shenandoah Valley Financial Education Program on Facebook or calling Karen Poff at 540-635-4549. Let me show you how to make your own plan or help someone you care about get through the crisis. Call 635-4549 or visit at NSV Financial Education on Facebook today.
Welcome back to the Valley Today. I am your host, Janet Michael. We are pre-recording today's conversation over Zoom. It is part of our community health series in partnership with Valley Health. So Dr. Rocky Fowler is with me on the Zoom screen today. He is a family medicine practitioner. His office is located in the Valley Health Warren Memorial Hospital multi-specialty clinic on Commerce Avenue. And Rocky, we were talking during the break about making sure that what you're doing when you're out in public is protecting you, but more importantly, protecting the person that you may run into or who's standing in line behind you at the grocery store. Walk me through, even though we've all heard it a million times, I don't think we can hear it enough. What are the precautions that we should all be taking right now?
You know, everybody has heard it a million times. It's precautions that we all need to take. The best website that you can just get them off of is the cdc.gov. I mean, that just takes you right through it. What do I do if I'm sick? What if I'm not feeling well? How do I protect my loved ones? It's simple. It's wear a mask and stay 6 feet apart. I mean, it's very clear cut. If you feel bad or start to feel bad, call your office. Call your primary care doctor's office. If you don't have one, look one up. Call an urgent care. That's the best advice. They don't advise most people to seek out medical treatment as far as ERs and things like that, because the majority of people will just simply have symptoms and they can get over it at home and they'll be okay. But by all means, if it says it right there on the CDC, if you have trouble breathing, shortness of breath, high fever, you think you need to go to the ER, please go to the ER. If you're having chest pain, please have chest pain. It's not unheard of to have a heart attack. During coronavirus times, it's not unheard of to have a pulmonary embolism or blood clot to the lung. None of that is unheard of, and that's why we say, by all means, don't just stay home. Period. You need to go and get medical help if you're suffering or something's going on. You know it's not right.
I saw a story earlier in the week on the news about excess deaths and the number of people who have potentially died, not with COVID, but maybe because of COVID, because they've been having chest pains or they have diabetes and they've not been keeping track of their sugar or taking care of themselves with their insulin levels the way that they are. And those people are now dying because they're afraid to come and get care, and they shouldn't be afraid, especially in the Valley Health system.
That's the biggest thing I fear that's come out of all of this is people neglecting their health. because of fear of getting out of the house or fear of going to some facility, a medical facility where people might have coronavirus. And that's why I tell them, that's why we have options of telehealth. That's why we have options of someone to speak to you over the phone. Hey, reach out. I don't know what's going on with me. We'll be glad to talk with you. Glad to help guide you through it, where to go, what to turn to. It's the best advice I can give. And, with all other things in life, it's pretty cut and dry. If people need assistance, if you say you're putting together a coffee table, you call a company that gave you the instructions. Hey, can I ask you a question? Sure. But it seems like people really get afraid when they have to reach out for their own health. They shouldn't, because if you don't have your health, what do you have? Your health is your number. If you don't have health, you're in bad shape. So that's the biggest fear, is this whole coronavirus pandemic, is people have been neglecting their chronic diseases. And then all of a sudden you're going to see a lot sicker, a lot faster people when everything comes back to quote normal.
Do you think when we get to some semblance of the other side of this, you're going to see an uptick in people trying to be more healthy and being more aware of their health in general, and just wanting to keep it at a better level than maybe what they have before?
One can only hope. That's my greatest hope. And I think, I've got confidence in the human spirit and their ability to survive. I mean, I think everybody's going to try to get better at this and get more healthy, especially when the majority of the headlines were, hey, coronavirus is killing, obesity. It's killing people with hypertension. It's killing people mainly with what we call comorbid things, something that goes along with it. And so that's why you need to hopefully turn those things around. And I think that's what's going to come out to be real positive in this situation. People are going to try to get healthier and stay healthy. Because, hey, if you're healthier, you can fight off a dangerous virus like coronavirus.
Well, and I think that's where the beauty of telehealth comes back in too, because if I've been cooped up in the house for 3 months and have decided, you know what, my Fitbit already said that I was a slug even before I ever got heard of any of this coronavirus stuff. Now I've decided I need to do something. That's a perfect intro to telehealth, to call you up and say, hey, this is who I am. This is how tall I am and what my daily activities are. That's a great intro to start that process, isn't it?
That's where we step in. If you think you're quote healthy, but you just want to get off on the right foot and start some new process and get healthy or get exercising, we can do those visits in telehealth and run labs on you and tell you if you're doing okay. And we can do get you to do your vital signs over the video teleconference. So it's all possible to do that from the comfort of your own home, just like you did. And I hate that you're so hard on yourself.
There was one day a couple of weeks ago when my husband and I spent most of the afternoon outside working, and I came in and my Fitbit was vibrating, and I looked at it and it said I had like 15,000 steps. And I looked at him and I said, I don't know why it's vibrating. And he says, has it never vibrated before? I said, no, maybe it thinks it was stolen and it's on somebody else's arm.
Oh, you're so hard on yourself.
Now, insurance in a lot of cases cover these telehealth visits too, right?
Absolutely. Yep. Yeah. That's the main thing, is to get people healthier and get them, like we discussed the first time we met, the common misconception is, well, I'm not sick. Why should I go to the doctor? That's not the case at all. And, that's what people need to do, is make a fresh start, get healthier, and set a common goal of more exercise, better diet. And I think that's we can set them off on the right start. We can even counsel them on that kind of stuff.
Well, and I think it's funny because people can be sick and not want to go to the doctor, but be sick and still feel like they need to go to work. It is like the craziest thing in people's minds sometimes.
We shouldn't have that type of mentality, but unfortunately, I think there was an article that healthcare workers are the worst at that. They're the ones that I know I've been guilty of before. They go to work when they're sick, but that's what we want to do, is keep people safe. And now especially, this has really woken people up to where before, when people would work with a fever or go to work sick, now that they're not so apt to do it. They'll stay home and they'll call their employer and they'll say, no, please stay home. And that's when they can call us and we can shuttle them to the right place and get them tested, or, get them in the right clinic that we need to see them at or something. Okay.
Are they doing the COVID testing at the respiratory care clinic, or is that set up in a different location?
We are setting up in Mount Jackson, but we are still seeing patients in the respiratory clinic in Front Royal at Riverton Commons,
Okay.
located by Walmart.
So before we wrap up, give me all of your contact information. If somebody wants to reach out to you and set up a telehealth or set up an appointment to come see you at the office, we'll throw your brother a bone, you or your brother Tolbert,
Yes.
even though, you know.
Dr. Tolbert Fowler, Dr. Rocky Fowler, both of us. We're one of 3 primary care physicians in the office. So they would actually call the internal medicine specialty clinic, can get an appointment, or they can call the family practice at Riverton Commons for Valley Health, and they'll direct them to appointment with us or appointment with someone available.
Awesome. And I will put that number on the show notes page.
Later in the future, might as well get used to it. So let's do it.
Right. Well, thank you for taking some time out of your schedule today to have this conversation with me. I do appreciate it.
You're so welcome. Contact me with the information. I want to get the link to this and watch it, because they say that 92% of people don't like the sound of their own voices. I hate the sound of my own voice.
Well, and today you're wearing a mask, as you should, but that's going to make your voice, it's not going to be a good air check for you. I wouldn't recommend listening to the show as your air check.
Yes, thank you. Well, thank you so much for having me, Jan. I really appreciate it. Call me anytime, okay?
I will do it. We were going to wrap up today's episode having our conversation with Dr. Rocky Fowler. He is a family medicine practitioner with the Valley Health Warren Memorial Hospital's multi-specialty clinic on Commerce Avenue. Tomorrow is Friday. Karen Poff is going to have a conversation with me about coping with a money crunch. She, of course, is with the Extension office. Meet me back here tomorrow a few minutes after noon, and I will have that show ready to go for you.